There are also other problems connected to acid-base status. You see here the structure of Proteoglycans. And you have a lot of these structures in our, we have a lot of that in our connective tissues. I don't go into details, but what I want to show you, these Proteoglycans here carry tremendous amount of negative charge. So, and this negative charge is extremely important, as the negative charge in these glucosaminoglycans in the extracellular phase is the reason why in these structures water is bound. And the water binding in the connective tissues is extremely important. So what happens if there is an acidosis? You exchange water with protons, with acid. And with this you simply neutralize this negative charge. And if you reduce the charge, you reduce the water binding. So the water binding capacity in acidosis goes down, and this leads to a loss of elasticity, and the structures are more rigid. And of course, you have then the chance of impairment of cartilage, of tendons and ligaments. So one reason for injuries in these structures might be a local acidosis. Well, the question then is, does it happen? If you ask many physicians, they say no acidosis, but there's no acidosis. If there is an acidosis, you are in the ambulance and go to the hospital and you have real problems. No, on the normal basis, there's no acidosis. They mean the acidosis in the blood. But there is an extracellular acidosis in the connective tissues, in the extracellular phase. However, it's not so easy to measure that, but there is a system you can measure that, and this has been done in this study. Again, this was quite heroic, because the calf muscle for that must be perfused with a pH-sensitive dye. Well, you can't do this with a patient. This is simply not possible, but with students you can do that. And then the students had to bicycle on an ergometer with 30, 50 and 70 watt, and the extracellular pH was measured, and you see it here. This is the interstitial pH. This were 6 students, and you see I take this. You see the pH in the beginning was 7.4, and just by 5 minutes on a bicycle, the pH with 70 watt goes down significantly, below 7.0. And remember what I've just shown you, 7.0 already increases pain sensitivity dramatically. And it takes another 20 minutes before it's normalized. And 70 watt this is not so dramatic. If you bicycle, you can 70 watt is every one of us can do that. So we have changes in our extracellular phase. You do not measure anything in blood. However, you have these significant changes. But you see also, well, people are different. This has something to do with training effects, but it has also something to do with what we eat. This is measured with the same method, and in this case, you see the interstitial proton concentration, the interstitial acidity, and in this case, the persons were supplemented with a placebo or with citrate. And you see, if they have the placebo, there's a clear increase in acidity, that goes down. However, if you have enough alkalines, you can avoid that. And that's what our ancestors did. They had a very alkaline diet, and they had, I'm quite sure, they had to run a lot. And so they could survive simply because they did not induce always the negative effects by this increase in acidity. So to avoid that, we should have enough alkalines in our diets, or we should have enough alkalines that we can, of course, also can take with supplements. And we did a study in patients with pain problems, and these were patients with chronic low back pain. And this was a study in 82 patients, and they were supplemented with Basica in addition to their usual medication for 4 weeks. And we measured the intracellular mineral concentration, but also determined the pain symptoms with the Aarhus low back pain rating scale, obviously invented here in Denmark. And this is often used for that. You see first the intracellular mineral content, and what you see, there's no change in potassium, sodium, calcium, and so on. However, there's a significant increase in magnesium just by having this alkaline supplementation with Basica. And the amount of magnesium in Basica is not so very high, but this really shows that an over-acidification leads to a loss of magnesium from the cells. And also, it was shown that the pain rating scale is significantly reduced after supplementation. So really, you have a very positive effect. But there are also, of course, other problems with pain, especially in patients with rheumatoid arthritis. You see here a normal joint, and you have in this synovial fluid, of course, also a normal pH. However, if there is inflammation going on, like here in arthritic joints, then the pH goes significantly down. You see this here. This is the acid concentration in patients with rheumatoid arthritis, with osteoarthritis or other forms of arthritis. And you see it's significantly increased in these patients. In normal patients, in healthy persons, not in patients, the acid concentration would be in that area. Unfortunately, in this study, this was not investigated. It is not so easy to convince healthy people. Just have your punctation of the knee done simply to measure the pH. This is, you have really to talk a lot on that. So, but it's known from other studies. And so what we did is then, again, a supplementation study with Basica in patients with rheumatoid arthritis. And these were all patients with chronic rheumatoid arthritis of a severe case. They were treated in a special rheuma clinic for that. And they were 12 weeks supplemented with Basica in addition to standard therapy. And then several things were determined. As you see first the disease-associated symptom index, and this shows that really compared to the control group, you see the Basica group has a significant improvement. But what is more impressive is the effect on pain, and this is what we expected. Really, with pain, after 8 weeks, the pain problems nearly halved, and there was even an increase in the pain problems in the control groups. So what can you learn from that? First, it takes a while when you make an alkaline supplementation. You cannot expect, if you treat patients with arthritis, that you have an effect within days. It takes weeks. This was 4 weeks, 8 weeks. After 8 weeks, we had a very we were very effective. The reason for that is the connective tissue is relatively badly perfused. It takes really a while until you have the alkalines where you need it. And so really, if you make an alkaline therapy, you must be, you must convince your patients really to take it at least a month, the minimum, better 2 months, until to decide if it helps or doesn't help. Also, the physical function index was significantly increased, and you see the longer the better. You see there's a continuous improvement, and well, okay, we couldn't do the study longer than 12 weeks. We also measured the amount of plasma endorphins, and these are the substance, our individual pain medication, to say. These are our happy hormones, and you see simply by alkaline supplementation you have an increase in plasma endorphins compared to the control group. Also, 1/3 reduction in the use of pain medication and of cortisol was achieved. So really it absolutely makes sense to use alkaline supplementation in these patients. It will not cure rheumatoid arthritis. Until now there's no cure for that. However, it will reduce the problems in the patients significantly. Another problem connected to pain, of course, is migraine. And there's a close connection of magnesium to migraine. And the magnesium level is reduced in plasma, blood cells, saliva, cerebrospinal fluid, and also the cerebrum in these migraine patients. And this is a nice study where the brain magnesium concentration was measured non-invasively, of course, by NMR. And what you see, this is the brain magnesium concentration in controls, and this is the concentrations in patients with migraine without aura, in patients with aura, with prolonged aura and migraine stroke. You see, the more severe, the lower the intracellular or in the magnesium ionized magnesium concentration in brain. Also in patients with cluster headaches, the magnesium concentration is significantly lower. So what to do? Well, relatively easy. You can make magnesium prophylaxis. And this was a placebo-controlled double-blind study where magnesium was given in a dose of 600 milligrams as magnesium diasporal for 12 weeks. And this significantly reduced the frequency of attacks compared to placebo. Well, in all migraine studies you have a huge placebo effect. However, then you see that magnesium is more effective than placebo. Also, the number of migraine days goes down. So really, this is very effective. In this study, 600 milligrams of magnesium were given. I know patients with severe migraine that use 600 milligrams, and well, we said, well, try more. And then they used 900 milligrams and said, yeah, maybe it's a little better. Yeah, maybe it's complicated with migraine. And then they said, well, if you stand it, try more. And now they are on 1,500 milligrams and nearly migraine free. So the problem is, some patients, you have to titrate them. You have to give them really, really high amounts to get magnesium into the brain. The blood-brain barrier is not very permeable to magnesium. You need a very high plasma magnesium concentration to bring magnesium into the brain. The study was repeated some years ago, again with 600 milligrams magnesium, and you see again the pain intensity in the magnesium group was significantly reduced. But again, see here, this is the time before supplementation, and also here it takes weeks until it works. You cannot, well, you could treat even acute migraine with magnesium, but not with oral magnesium. Then you must infuse magnesium. But this is, well, it's impractical, and it can't, on a regular basis, can't be done. So what you can achieve is a lot of pain reduction simply by giving continuously high amounts. And there's another study, a recent study in children with migraine. Well, I don't go into details here, but what I want to show you here, these were boys and girls that received acute pain medication, acetaminophen or ibuprofen, against their migraine attacks, or they received this, and in addition magnesium. You see down here acetaminophen plus magnesium, and what you see significantly after 3 and even 18 months, this is really a long-term study, the migraine problems, the headache days per month go significantly down in all groups, boys and girls receiving magnesium. So really, magnesium is the substance of choice. And there is a newer editorial on that, why all migraine patients should be treated with magnesium. You see, magnesium is widely available, extremely safe, inexpensive, and for patients who are deficient can be effective, highly effective. So the fact that magnesium deficiency may be present in up to half of migraine patients, and routine blood tests are not indicative of status, empiric treatment with at least oral magnesium is warranted in all migraine sufferers. So this is now treatment of choice. There's a question? Oops, sorry. You can ask it later on. Yeah. Sorry?
Jeg vil gerne vide migræne. Det er lige meget, hvad for en type migræneanfald man bliver påvirket af. For eksempel stress, vind og vejr. Har det der så også effekt?
She wants to know if it's effective by any kinds of migraine. If it's
different kinds of migraine. Well, it does not work in every patient with migraine. All studies show that you will have roughly about 50 to 60% of patients with migraine that will respond to magnesium, at least to the dose of magnesium. Maybe in the studies the dose was not high enough. But with a relatively high dose of 600 milligrams of magnesium, you have a response rate of 50 to 60%. So you cannot cure cure everything, everyone with migraine simply with magnesium, but you reduce the number of migraine attacks. And it is now from last year, or from 2012, that the Canadian Headache Society released guidelines for migraine prophylaxis. Unfortunately, I don't know the situation in Denmark, if you have guidelines for that. But for magnesium, they write, we recommend that clinicians offer magnesium to eligible patients for migraine prophylaxis. There is evidence for benefit and side effects are minimal. Due to the contrary evidence presented in these trials, we recommend that 600 milligrams of magnesium as magnesium citrate be used for migraine prophylaxis. And that's a very important point. We come here to the kind of magnesium that should be supplemented. All the studies that were positive with regard to migraine used magnesium citrate. That was mainly magnesium diasporal, but also a few other studies. But it seems to be important that you have a salt with a high bioavailability. So as you need really high doses, then you need a salt that gives you, that allows you really to get the magnesium effectively into the body. And so positive results were only obtained with magnesium citrate. But also magnesium citrate, in this case again magnesium diasporal, is effective in tension type headaches. And this was a study with 40 patients with headaches, with severe tension type headaches and special headache clinics. And you see that of these 40 patients, there were even 6 patients free of symptoms and 19 had good improvements. So really this shows at least you should give magnesium a try. So really the chance that your patients will benefit is really very high. Okay.
I have a question.
Yes.
Can you overdose magnesium, and if you can, what are the symptoms?
If you overdose magnesium, the only thing that can happen is you induce diarrhea. Roughly, if you take 300 milligrams of magnesium, in this study, 600 milligrams magnesium, the incidence of diarrhea was 10 to 15%. However, only in the beginning. If you reduce the dose then and stay on a lower dose for a few days and then increase it let's say every second day, the intestines adapt somehow to magnesium. The mechanism is not known. Nobody knows why, but it simply works. After a while, you can tolerate these higher amounts. And if you have patients that do not tolerate these high amounts, you should distribute the dose over the day. Usually you can take it 300 milligrams in the morning, 600 milligrams in the evening, usually not on an empty stomach. This really could induce then very easily diarrhea. But then you simply take it over the day. You dissolve magnesium and zip it over the day or put it into a bottle and drink it. Then usually that's not a problem. Yeah? And that's the only thing that can happen. As long as the patients do not have severe kidney failure. But then they are close to dialysis. They know that then.
What doses were used to children?
For children, yeah, it depends how old the children are. You can easily give children 100 milligram. That's no problem. But you can also give to 12. I'm aware of studies where they gave or patients where they gave to 12-year-old children also 300 milligrams of magnesium. Nothing dangerous can happen. There's no problem. The only thing is diarrhea, and then, well, reduce it then. Yeah?
Normally, it's told to take calcium and magnesium together.
Yes.
1 to 2.
There's absolutely no reason for that. This is absolutely without any scientific basis. This is simply because it is said, well, okay, you need twice more calcium than magnesium. But you should not take magnesium and calcium in a single supplement. Because if you have a high-dosed magnesium, it will reduce the absorption of calcium, and a high-dosed calcium will reduce the absorption of magnesium. So if you take calcium and magnesium, take the calcium in the morning and magnesium in the evening. Keep it several hours apart, then it's no problem. Especially if you have it in a tablet, where you have it and that dissolves in the intestines in a small volume. There you have very, very high concentrations relative of calcium and magnesium, and then you have an interaction. Yeah?
It's also getting very modern to take magnesium in a bottle and as in oil consistency.
Transdermal magnesium simply doesn't work. We've just finished a study where we carefully investigated the absorption of magnesium through the skin. And the skin, well, if this would work, I would simply say, if you have magnesium deficit, go swimming in the sea, in the ocean. As in the ocean, you have 100 times the magnesium concentration than in blood, and so then you should soak up the magnesium, and that's not the case. Easy. No, this is well, it works if the massage has an effect, but there's no up to end. Well, there might be an effect if you have problems with the skin. That is known. If you have some skin diseases, there extracellular or magnesium on the skin, there might be an effect. But you cannot dissolve the problem of magnesium deficit by having magnesium on the skin. Well, the skin is not made for that. We have a very effective organ to do that. That's our intestines. And you can simply swallow the magnesium. Why to put it on the skin? It doesn't make sense. Okay, so a little to osteoporosis and acid-base balance. You see, this is a very elegant study where people received a diet with relatively low protein content. That means it's relatively low in acidity. And you see here the calcium excretion, urinary calcium excretion. And then the diet in these people was changed to more protein, so more acidic. And you see the acid excretion parameters here, they significantly go up. But also the calcium goes up. And it was carefully supervised, this study, that really the calcium intake was absolutely the same. Also the absorption was the same. This was investigated. But you see there's an increase in calcium, nearly a doubling. So that means this calcium comes from body stores. And where are the stores in the body? It's just the bone, nothing else. 99.9% of the calcium is inside of the bones. And if you lose calcium, then it's calcium from the bones. And you can avoid that simply by adding alkalines. And you see calcium excretion goes down, acidity goes down. So simply by changing the acidity of your diet, you have tremendous effects of of your calcium balance. So for sure, calcium is osteoporosis is not so easy to. It's not. You cannot say it's a calcium deficiency disease. Absolutely not. It's also not a milk deficiency disease. It's a problem of balance, and an over-acidification is the main problem of having losses of calcium. And that studies showing this more and more. This is the more acidic, the more active the osteoclasts are. These are the cells that are degrading our bones. And then acidosis stimulates the bone degrading cells. And also in epidemiological study, it has been shown that the bone mineral density goes down the higher the acidity of the diet. So the more acidic the diet, the lower the bone density. So then you should say, well, okay, does alkaline supplementation have an effect? And this was done in this study. There was a citrate supplementation in patients in women with osteopenia. That means they already had reduced bone density. And it was quite elegant, this study, because they supplemented either potassium chloride or potassium citrate. That means all received the same amount of potassium. In this case, potassium chloride in a neutral salt, or with citrate in an alkaline salt. So the only difference is neutral to alkaline. And they all received calcium and vitamin D. And what you see here, this is the group with the potassium chloride. You see the bone density goes down, even though the women received calcium and vitamin D. However, in the potassium citrate group, you have even an increase in bone density. So really, this shows that it's the alkalinity that improves the bone density. And this study was, not exactly repeated, but a similar study was done in a placebo-controlled study, potassium citrate against placebo. And again, you see here the group with potassium citrate has a significant increase in bone density, and the placebo group has this loss in bone density study on over 2 years. So overall, this really shows a loss or a surplus of acidity in our system is compensated by release of minerals from the bone. And of course, then on the long term, this increases the risk for osteoporosis. So I have some time? Yes. Okay. There's also connection of acid-base status with our brain. And this is, again, a nice study, acid-base metabolism and IQ. And in this study, the intracellular pH in the brain, in the central nervous system of 42 boys was correlated to their IQ. And you see here, this is the brain pH. Here it gets getting more acidic, and here I would say it's getting more stupid. And what you can say is the more acidic, the more stupid. Unfortunately, it was not done that these 2 boys were supplemented with alkalines to see after some years where they are. For sure, it's not so easy. It simply should show you that there is a very interesting connections between acid-base balance and many physiological functions. And also here, unfortunately, I don't have the time to go into the aspects of Alzheimer's disease. But what you can see, there are many functions that are involved in, or problems that are involved in Alzheimer's disease. However, you see here also acidosis plays a role, and also here in this area the sedimentation of plaques. Also here you have a risk factor of acidosis. And there is a relatively old study that showed that there is a dramatic aggregation of Alzheimer's plaque that is induced by conditions representing physiological acidosis. That means pH changes that can be achieved in the brain will influence the deposit of these Alzheimer plaques. And what you can do here in this study is they simply changed the pH and they have an aggregation, then they made it more alkaline, it dissolves again, they make it acidic, they have aggregation again, and so on, and so on, and so on. Well, there's no chance to measure it in vivo in a brain. This, you can't do this only in vitro. However, it really could be that these deposition of proteins is influenced by an acidosis. And this acidosis, of course, can be avoided. And this acidosis might have influences on intracellular magnesium status. You see, acidosis and magnesium are closely connected. And it is known since long that there's a problem with magnesium status in Alzheimer's disease. Magnesium concentration is reduced in mild to moderate Alzheimer's disease. low serum magnesium levels correlate to clinical deterioration of Alzheimer's, and it is now known that magnesium modulates the amyloid beta protein trafficking and processing. So magnesium status seems to be really important. And there is even there are animal experiments where these were animals that were that had a transgenic disease resembling Alzheimer's. Nobody knows exactly what Alzheimer's is, but these animals develop symptoms similar to Alzheimer's disease. And compared to animals without this effect, this is the survival of these mice. And you see the animals with this transgenic defect, they die earlier. However, if you supplement them with magnesium, if magnesium treated group here, you have the same survival compared to the wild type group. So really in these animal experiments, magnesium was really effective simply by elevation of brain magnesium. And there is a very new study from Australia that is, I would say, really amazing. It's an epidemiological study, the Path Through Life project, dietary mineral intake and risk of mild cognitive impairment. And you see here the dietary predictors of transition from normal aging to cognitive deficits, to dementia. And this is a mild cognitive impairment and mild and moderate cognitive dementia. And you see, well, okay, calcium has not a significant effect. The relative risk is set to 1. And you see calcium, well, no effect at all. Iron, there is an effect. It increases the risk. Well, this is known since long. If you have too much iron, this is not very good. You should not have too much iron in your body. However, here look at magnesium. If you have a high magnesium concentration, you can reduce the risk from 1 to 0.08. That means more than 90% risk reduction compared between the group with the lowest magnesium intake with the highest magnesium intake. What was especially important, this is only true for men, not for women. And this was confusing. Well, why in men, not in women? And a really dramatic effect in men. And it was explained by that way that in this population, unfortunately, they did not do magnesium measurements. However, they determined the intake, and the dietary intake in women was much higher than in men, because they simply, women eat a more healthy diet than usually men do. And so really this is, well, you can't see it here, it's just from, this is from this year or last year, and a very new study that really have a dramatic effect. More than 90% reduction in dementia simply by one. There's no study worldwide that has any effect of any micronutrient with this amount, more than 90% reduction in dementia. And it's a large study. And so, well, I'm quite sure that really with magnesium, this opens new areas. So, and you don't have it in your papers. I just want to show you, this is only in German, that we have just published a book, the Anti-Alzheimer Formel, the Anti-Alzheimer Formula, Diet, Essen gegen das Vergessen, I can't translate it. Eating against dementia or something. And what we did, we changed the diet in patients with dementia and increased the amount of coconut oil in them by providing them an an alternative fuel, the ketone bodies, and we gave them Basica, and we gave them coenzyme Q10. And all over that, we improved in all patients. There was an improvement in their dementia problems. There's also connections with magnesium with Parkinson's disease. Magnesium exerts preventive and positive effects in models, and it is now known that Parkinson's disease is genetically linked to this gene, the SLC41A1. It has been shown that this gene is changed in these Parkinson in a certain amount of these certain percentage of these Parkinson's patients. And what we could show some years ago, and it took us, well, nearly 20 years to find this out, that really this genes, this SLC41A1, encodes for a sodium-magnesium exchanger. That means if you have a changed activity of this gene, then you have a changed ability to modulate the intracellular magnesium status. This transporter brings magnesium out of the cell, and if there's more, and the point is, in these patients, there's an overactivity of this gene, and that means they have more magnesium loss than normal, not impaired persons. And this brings us to the area where also again magnesium can be used, and this was a study, magnesium supplementation in treatment of depression in elderly patients with type 2 diabetes. And this was a depression score, and you see that magnesium was as effective as this imipramine. Magnesium was really reduced this score significantly to the same amount as imipramine, an antidepressant, did this. And we could show some years ago that imipramine inhibits this magnesium transporter that brings magnesium out of the cell. So if you keep magnesium in the cell, you obviously have a positive effect of in the area of depression, and there are currently some relatively large studies going on by treating patients with depression with magnesium. Okay, come to the last area, that is mineral imbalance and pregnancy, especially with regard to magnesium. There are many effects of magnesium deficiency in pregnancy. If there is magnesium deficiency, there is an increased rate of preterm birth and abortions, increased preterm labor, reduced birth weight, fetus development is impaired, hypertension is increased, leg cramps, of course, occur, and so on and so on. And symptoms, headaches, undefined symptoms, they might be connected to magnesium deficiency. And there are several studies on magnesium and premature labor, and this is a study with magnesium diasporal, and you can really see that by simply administration of magnesium, you can reduce the incidence of premature labor significantly. And we did recently a study in the area of Gothenburg, and we supplemented magnesium to prevent high blood pressure in pregnancy. It was a randomized placebo-controlled trial, and it was a study with 59 pregnant women, and they had an increased risk for pregnancy-induced hypertension. And this is the case when there is an increased urinary excretion of calcium and magnesium in the early phase of pregnancy. And we supplemented them with magnesium or placebo from week 24 till delivery. And in addition to these women, we had also a group of untreated, that did not want to take part in a supplementation study. So what was the effect on the blood pressure? So this is the untreated group, and you see there's really a significant increase in the incidence of hypertension, of blood pressure increase of more than 15 millimeters mercury. And this is the placebo group. Well, we choose women with a high risk, so really it shows that this really worked. We did the study with the right patients. You see really here the risk goes up nearly to 40%. And however, if we supplemented women in this group with magnesium diasporal, we simply could avoid the increase absolutely. So really the supplementation with magnesium can avoid the pregnancy-induced hypertension. And this is extremely important, as pregnancy-induced hypertension can lead to preeclampsia, and preeclampsia can lead to eclampsia, and this is the most severe problem in pregnancy that can occur. And we are now doing a very, very large study worldwide, because in Sweden and also Denmark, also Germany, the incidence of preeclampsia is relatively low, few percent, 3 to 5%. However, there are areas in the world where the incidence goes up to 30 to 40%. And we are now doing studies in compare magnesium supplementation in Europe, in Sweden, Germany, and in Mexico, and in Tanzania, where the incidence is very high, and well, magnesium supplementation is relatively easy. This can be done, but unfortunately it will take some years until we have the results. So let's come to the last area of how to supplement and how to estimate the status. Estimation of acid-base status. Well, of course you could measure the urinary pH. Unfortunately, this does not give you a very good indication, as 99% of the acid is excreted in bound form, and we have large physiological fluctuations. So if you do that, you have to measure the urinary pH over several days, several times a day, and so then you can say something. Better is net acid excretion in urine, but this, of course, to sample 24-hour urine is not so easy, and you have to titrate that. This is for routine, it doesn't help. So what can be done is the estimation of dietary acid load. For that you need to know the acid-alkaline contents of food, but however you also must know the relative bioavailability of these compounds, and then you can calculate the potential renal acid load. I've shown you already that, and these PRAL values are really now worldwide used. We developed that together with a group from the German Institute for Child Nutrition, and we compared the estimated net acid excretion with the PRAL values with the analyzed. We really measured in the urine, and you see there's a close correlation. So really the PRAL value gives you a hint what your diet is concerning acid-base balance. Oops. So what is acidic, to make it easy? This, of course, if you eat a lot of meats and sausages, this goes on the acidic side, but also cheese. You should not forget, if you eat Parmesan cheese, this is the most acidic food you can eat. Also fish, this is what most people do not know, everything made from grains is also acidic. Bread, pasta is acidic. So if you eat a lot of meat or sausages with a lot of bread, then you have a tremendous amount of acidity. And if you eat that, then you have to compensate it. And you could eat, of course, a lot of fruits, better salad, and even better vegetables. Then you can compensate for that. However, roughly you have to eat 4 times as much on a weight basis of vegetables to compensate for meat. So if you eat 200 grams of meat, you have to eat 800 grams of vegetables to neutralize the acidity of the meat. Yeah, and usually you eat bread with the meat. If you eat potatoes, that's okay. Potatoes is alkaline. It's much better than pasta. So for some people, then the choice is to use alkaline supplementation. And the question is, what is really the alkalinity in a supplement? For example, if you take magnesium citrate, if you ingest it, it dissociates into the organic anions and the magnesium, the citrate. And this citrate, that's the point, this citrate is negatively charged and can bind protons, can bind acid. And then you have here the citric acid. And the citric acid can be easily metabolized, mainly in our liver. And so the point is, we get rid of acid from our body without using the kidney. That's the point. We do not need to excrete these protons. What we have to excrete then is the magnesium or the potassium or the sodium, whatever is bound to this citrate. But for the kidney, it's much easier to excrete a cation like this than to excrete protons, because we cannot excrete free protons. If we would excrete it, our urine would have pH 2. We wouldn't stand that. And so it's bound. And this binding to ammonium is, well, it's complicated. So if you then supplement, of course, there are many supplements on the market using bicarbonates. And bicarbonates is not a good choice for alkaline supplementation, because at first the bicarbonates neutralize the acid in your stomach, in our stomach. And the gastric acid is extremely important because we need it for the release of micronutrients from the food. And so it's not a good idea to neutralize that. Well, there is an effect, of course, but it's not continuous and the taste is not very well. It's much better to use the citrates, because this is the alkaline substance that we also have when we eat an apple or when we eat vegetables. The alkalinity is the organic anions, mainly the citrates. No influence on the gastric pH, good absorption of the minerals bound to that, and we have a delayed but long-lasting and intense effect. And the taste is okay, and for that, what is very, very important, the compliance is good. If you have a bad taste, people won't take it for long. So, next question, who should take it, especially who should take magnesium? First, you should have a look at clinical symptoms. Of course, you can also measure plasma magnesium concentrations. But you should also have a look for risk factors. For low magnesium intake, ask your patient what they eat, or especially ask them what drugs they need. If they take a diuretic, they need magnesium for sure. And so there are many cases where you automatically can show or easily guess who needs magnesium. Plasma magnesium concentration should be not below 0.85 millimoles. So as this is the value for health, approximately 0.85 millimoles. If you're above that, then you're quite well. You're quite okay. However, there's one problem. You could have artificially increased plasma magnesium concentrations because stressful conditions drive magnesium out of the cells. And when I come to you and want to have some blood, I come with a needle. Many people are afraid. And this is stress. And under this, within seconds, magnesium is released and you have an artificial increase in plasma magnesium concentrations. And then you have the value and say, oh, your plasma magnesium is very good, it's very high. And then you have a patient say, so well, he is deficient, but he's simply very anxious. And so this is a problem. So there is an underestimated problem of using serum magnesium measurements to exclude deficiency in adults. That means if this plasma magnesium concentration is low, it's for sure deficiency. If it's high, it does not exclude deficiency. Okay, I can skip that. So what magnesium should be supplemented? Well, I've just said it. It makes sense to take magnesium citrate. This was a comparison between magnesium amino acid chelate, magnesium oxide, and you see the magnesium citrate is the only that really gives significant increases in plasma magnesium concentration. So really it makes sense. With oxide you have nearly no effect. So it really makes sense. And coming to the end, there's also very new results concerning the effects of magnesium. Magnesium regulates cytotoxic function of natural killer cells or T cells in chronic viral infection. And this was also shown in Nature. You see here Nature reviews immunology. There's certain patients with X-Men disease. So these results show an important role for free basal magnesium concentration in regulating cytotoxic immune response, especially to viruses. And we could show that really, especially in these cells that are needed for the immune response, the leukocytes, that really in these cells magnesium citrate is much superior to magnesium oxide to increase the intracellular magnesium concentration. So really you can, by increasing your magnesium citrate intake, you can increase your immunity against viruses, especially viruses. And so really, if you supplement magnesium, take magnesium citrate, then you have a good choice. So there's no overdosage when given orally. This is the normal value, around 1 millimole per liter. Of course, if you have very high dosages, then this could even lead to cardiac arrest. But this is impossible orally. This can only occur with parenteral administration. So magnesium is really absolutely safe. Only in patients that have a severely damaged kidney function, you must be careful, but with all minerals, of course, if you can't excrete, then you have problems. I skipped that. So magnesium is really a life-saving mineral, and for that magnesium diasporal is really the perfect magnesium supplement. Many clinical studies. You have a high bioavailability. There's an alkaline effect. You should not forget that. There's a broad therapeutic spectrum, good taste, good compliance, no serious side effects. However, you should also think of that we are, due to our Western diet, are in the status of acidosis, and this contributes to various diseases, but also might contribute to aging. So, there are some secrets of staying young. Of course, enjoy life, That makes sense. Go to hard rock events. Maintain physical and mental function. That's very important. You should eat a healthy diet. Avoid acidosis. Use alkaline mineral supplements, especially with magnesium, like Basica and magnesium diasporal. But there's also another point you could use. Lie about your age. Thank you very much for your attention.